Hi, everybody. Thank you for joining us. My name is Chris Riley. I'm the Public Engagement Information Manager for the Victor Valley Union High School District, and I would like to welcome you to our COVID-19 Town Hall. So thank you very much. I see we already have a lot of comments. We are going to get to them. First, I want to introduce our panel for this evening. I'm going to start with our Superintendent, Dr. Ron Williams. And there he is. And then we're going to bring in our Assistant Superintendent of Educational Services, and that's Dr. Fall Esrani. And we have our Assistant Superintendent of Business Services, that's Dr. Antoine Hawkins. We have our Assistant Superintendent of Human Resources, and that is Dr. Ramiro Rubalcaba. And we have a very special guest with us, an expert in epidemiology, and that is Dr. Vincent Covelli. So thank you very much for being with us. And we lost Vincent. He was with us and then he was gone. Okay, he's back. Might be some connectivity issues. Hi, Dr. Covelli. Thank you for being with us.
Hi, thank you.
Thank you very much. So to kick us off, I am going to turn it over to our superintendent, Dr. Ron Williams.
Thank you so very much. I know it's been a time since we've had the opportunity to come and meet with all of you. We did our town hall meetings a couple of months ago. We've made some changes at that particular point in time. We had to postpone our starting, and now we feel that we have a pretty nice date locked in on April the 12th. We appreciate you coming to be a part of this, and we probably want to share with you the most up-to-date information that we have. I know that all of you most logging on this evening have one primary question: when are students coming back? I know some of our staff members have questions, but we've shared this information with staff, and we look forward to to our students coming back. Initially, we're going to be starting off with a small group. We do have cohorts that have returned already at this particular point in time. That will be shared with you later on. But I know that most of the underlying question is, the vaccine. We've had testing Tuesdays for our staff. At this particular point in time, our eligible groups are, healthcare workers, our educators, long-term care, nursing facility residents, those 65 and above, food and agriculture, childcare educators, as well as emergency responders. There's one new group that's been added, those in high risk and living in adult care facilities, as well as certain transit workers. As of March 15th, our healthcare providers can use their discretion to provide vaccines for those individuals 16 to 65 at very high risk, as well as those having severe health conditions and disabilities or illnesses. Staff members are more than welcome to return on March 25th through March 24th through April the 5th. Our seniors will be invited to return on April the 12th. Our small cohort started on March 15th, and other cohorts may be returned based upon public health guidelines. At this particular time, our positivity rate, as well as our infection rate per 100,000, has dropped significantly in San Bernardino County, and we're hoping that we continue to trend in that manner. We have a question comment. So we had a number of individuals that sent questions in earlier. We're going to try to address those. Our basically agenda for this evening is that we're going to spend the first 30 minutes talking in regards to what we've been doing and what we have planned. And then the last half of our time is set aside for us to answer questions, those that were sent to us beforehand, as well as questions in our comment section. So with that, I will turn it over to Dr. Esrani, because she was introduce secondly, so that she can share some of what we have planned from our educational services perspective. Dr.
Thank you and good evening. Thank you, parents, for being here with us today. We're really excited that we were able to work with our principals very closely and our teachers and get the opportunity now to get small cohorts back in our school. And as per the guidance from California Department of Education, we can provide services to small groups of children who are in English language learners, our foster youth, our homeless students, and students at need. We also identified that it would be very beneficial for us seniors who are failing to come in, as well as seniors, as well as ninth grade students who have not entered the campuses yet. So our teachers and our principals have been working on that. We're very proud of that we can provide that service to them. But we also received directions after we started the small cohorts that we could bring back one grade only at the high school level. So obviously we looked at our seniors. This is a senior year. We've only got 7 more weeks to go before school ends. And again, working closely with our principals and our teachers, we have made a plan that starting April 12th, our seniors who choose to come back will be able to do so. So our principals sent home a survey, and we've been getting responses from parents and students about who would like to return. Today, I visited some of the schools, visited Victor High School, some of the classrooms, and we were able to see how well the teachers have got the classroom ready to welcome children back who wish to come back. There will be no change in the schedule when children return. We will continue with what we currently have. So children will be able to attend those classes and hopefully be able to catch up and graduate with their peers. And so any questions, I'll take them when the questions come up. Back to you, Dr. Williams.
Thank you so very much, Dr. Aswani. I know that for many of our students, and probably for all of them, I know that I've received numerous emails from students as well as parents asking questions. When will our child have the opportunity to return back to school? We miss all of you. Our teachers miss you as well. Our teachers are planning upon your return. I know that many of you have had a great experience in the virtual environment. And for our seniors, as Dr. Aswani mentioned beforehand, after spring break, we have approximately a little over a month and a half before the end of the school year. And that's one of the primary reasons why we're focusing on our seniors. But as time progressed in between the time we return on April the 12th to the end of the year, if the positivity rate and those things continue to stabilize and or move downward, we will be looking at other groups that we can consider bringing back at that time. Next, we have our Chief Business Official, Dr. Hawkins.
Thank you, Dr. Williams. And first of all, I'd like to welcome all of you on this meeting. Hopefully that you're remaining safe during the COVID-19 pandemic. When it comes to the expenditures that the district has received and some of the dollars that we've utilized in terms of expending resources, the first round of CARES Act COVID-19 funding that came from the federal government that was tied to the legislation that was passed under the Trump administration, the district was able to receive an infusion of $21 million. The second round of COVID CARES Act funding, we are estimating receiving $24 million. And then there is now, pursuant to legislation at the federal level that just passed within the last 6 weeks, the American Rescue Plan Act of 2021. I found out yesterday that it will be 2.5 times the amount of money that we received in the last federal stimulus piece, which for our district would be around upwards to $60 million. On top of that, the governor, as most of you parents are aware, made some incentives available to school systems who are returning to school. So we're also slated to receive $12 million that's tied to AB 86, Assembly Bill, or Senate Bill and Assembly Bill 86. Where does that money go to? One of the things that with the superintendent's guide in concert with executive cabinet, we ensured that we had technology updates such as Chromebooks, which were purchased and made available for students. We purchased Wi-Fi hotspots that not only were used in the home, but we also were able to do something in terms of equity that we don't know that's been done or have not seen done in this area. And that's, we worked in concert with Ed Services to identify some areas in our community where we're providing Wi-Fi hotspot devices on school buses. Finally, we pivoted to infrastructure upgrades, knowing that we're in a totally new environment when it comes to technology. We wanted to be sure that we had a robust infrastructure that's able to meet our critical needs. And then Dr. Rubalcaba will talk a little bit more about this, but I'll just touch on it very briefly. We purchased a plethora of personal protective equipment, which deals with face shield, mask, and some other items. And then finally, during this time, we've, in a measurable way, continued to feeding in our community feeding program for all of our students in the community. And that's it, Dr. Williams. Thank you.
Thank you so very much, Dr. Hawken. And as I was reviewing the comment section there, let me clarify. We're starting with seniors. Other grade levels are impacted groups. We will be exploring which other grade levels and impacted groups we will consider at a later time as we move forward. So it's not, we're starting with seniors, but we're not saying that only seniors will be returning. So I want to make that very, very clear for everyone. Okay. Now, also, we have Dr. Rubalcaba, who is our Assistant Superintendent of Human Resources.
Thank you, Dr. Williams. Want to welcome everyone. Hope everyone is doing well. And we thank you for being a part of this meeting. I'm very happy to share that the district has done a great job in really making sure that we keep our students, families, any visitors, and our staff safe when entering our campuses and participating in the educational process. One, it started with education. All of our employees are required to take a COVID-19 course. It's a course, online course, along with the test that shows that they passed the course to make sure that we all understand the importance of social distancing, how this disease is transmitted, and how to stay safe. Number two, as Dr. Hawkins mentioned, we've invested a great deal in PPE and other precautions such as symptom screening. We have touch-free thermometers. We have walk-up kiosks that do face recognition and temperature taking. Anyone entering our campuses must be screened. We ask the questions, if they've had a fever of 100.4 or greater, and if they have any symptoms. So everyone is screened prior to entering our facilities. These precautions also include desk shields for any student, shields for high traffic areas for our employees and visitors for entering our campuses. The other precautions include some of our face shields with drapes for those that cannot wear a mask. We have reusable cloth masks and disposable cloth masks for any staff member, student, or visitor that needs one. We are one of the very few districts, I think, that invested in a consultant, which you will meet shortly, Dr. Vincent Cavelli. We've invested in electrostatic magnetic cleaners for all of our custodians and all of our athletic trainers to utilize and keep our learning areas safe and clean. We've invested in everything that you can think of, from air purifiers to ionizers that are installed in every HVAC unit. And all of that is because we care. We've invested in protocols and invested our resources and time to meet with our principals, athletic directors, or athletic trainers and coaches to safely bring back athletics and other student activities. Our principals are doing a fine job of hosting activities like drive-through events and movie nights in their cars to keep our students engaged socially, emotionally with other students. In addition to what was already mentioned with the small cohorts serving populations in person, we offer learning pods for students who may not have the internet access or connectivity issues or other challenges at home with a suitable learning environment. We've created learning pods at each of our campus where 4 days a week, our students can learn at our school site and be supported by a certificated staff member. We are also working in collaboration with our labor partners, our classified employees, our certificated teachers union, and of course our management team, which also extends to other school districts in making the vaccine available to all of our employees who want it. In addition, as Dr. Williams mentioned, the Testing Tuesday that is available to all of our staff for asymptomatic testing, and we hope to make testing available to our students. So we've done everything we possibly can to keep everyone safe and continue the educational process. Back to you, Dr. Williams.
Oh, thank you so very much. Now, Mr. Riley, I don't know if our VVTA president, Mrs. Tucker, or our CSEA president, Mrs. Tanya Martin, is available. I don't know if they're in the waiting room or not.
You're muted, Chris.
Sorry about that, guys. I have heard from Anita, but I have not seen her in here yet. There's Anita. I heard from Tanya, but I haven't seen her. So let's say hi to Anita Tucker.
Okay. Beforehand, let me introduce Anita Tucker is the president of the Victor Valley Teachers Association. Anita, would you like to share a few comments?
Good evening. We're excited to look forward to having our students back. Your teachers have done an amazing job working with the students for the past year in distance learning, creating a totally different way to teach. We're excited to see our students back and work with them. We want to make sure it's done safely. That's the biggest priority we have, that we are available to be there with our students, that it's safely done, and we're going to continue to work with the district to ensure that and do what we can to make sure it's safe so we can see our kids, be able to see their faces, and be there with them. So thank you very much.
Thank you. And we are very, probably one of the few districts in San Bernardino that went out and hired our own epidemiologist, Dr. Covella. So is there a couple of comments that you would like to make?
Oh, hi, everyone. And yes, thank you again so much for having me. So as Dr. Williams mentioned, I serve as kind of Director of Infectious Diseases, and I'm in charge of ensuring that everyone at St. Mary Medical Center is safe, including staff and patients. So I'm happy, and hopefully we'll be able to bring my expertise to the district and ensuring that all staff and students feel safe as we begin to return to class. So it's my pleasure, and I'm happy to answer any questions. Just type in the box, and my pleasure to be here.
Okay,
we really
thank you.
we really appreciate you being here with us. And we do have a lot of questions and comments. Dr. Williams, was there anything else you'd like to say before we open it up to questions?
Is Tanya Martin, Mrs. Tanya Martin, the president of CSEA? Do you know if she was able to make it with us?
She's texting me and saying that the link is not working.
Okay.
It's the same link I sent to Anita, so there just might be some connectivity issues. But let me try one more time and see if maybe we can get Tanya in here. And I'm going to send that link to her one more time.
And while we're waiting, I'll just go on to sit down and say that in San Bernardino County, specifically a couple of months ago, our positivity rate per 100,000, as well as our positivity rate was significantly higher, that our communities have done an excellent job of addressing these issues recently. And we hope that, continue to move in that trend. The working relationships that we have with our school board, our associations, to try to get have our students to return. There's a commitment that we've been unwavering. We're a high school district. Initially, the return was set up for the elementary schools, those primary grades, moving on through grade 6. And high schools, secondary schools could not start as changes in the guidelines and has given us the opportunity, as well as our infection rate. So the things that have happened in the last couple of weeks have given us that latitude that we did not have earlier this previous year. And we're very fortunate to be a part of those guidelines. Although those guidelines have been changing regularly, we've tried to adjust to it. Mr. Riley, were you able to get her? Or? shall I continue?
She said move on without me. So maybe she's trying, and maybe we'll see her, but I do not see her right now. So we'll just keep going, and hopefully they will
Okay.
be able to get in there. Now, also, you may have noticed there's a couple of if you're watching on YouTube, you may have noticed there's a couple of commenters that you can see on YouTube. You're not seeing them on our screen, but they're coming up on YouTube, and we are going to block anyone from our YouTube channel that uses profanity of any kind or just anything that's not appropriate to our content here. So just be careful, because if I see someone else use the S word here, and so I'm sorry, we'll have to say bye-bye to you as well. But we have we do have a few comments of some substance here amongst some of the noise on there. So we can start out with when are all the students coming back? And I think that's an easy enough question. So who wants to take that one?
Well, I'll start off and say that, all of the students, that's we hope by next year at this time. And if we continue to move in the directions that we're moving at this particular point in time with the infection and positivity rate, there's a strong possibility. But keep in mind that we only have a little over a month and a week or two of school to go. We're starting with our seniors, as I mentioned earlier, and we're looking at bringing back potentially other grade levels or other impacted groups. We would love to have all of our students back, but we have public health guidelines that we must follow. And that's from my perspective, and I'll let Dr. Rubalcaba as well as Dr. Cavella address it as well.
Thank you, Dr. Williams. So yes, that is correct. I think it's really important to keep in mind, we are serving a lot of students right now under the small cohort model. We're serving our students with disabilities. We're serving English learners, foster youth, homeless youth, students who are struggling with connectivity, other populations who are having challenges succeeding in an online platform. We are welcoming them on our campus through learning pods. So we're very happy that our classified and our teachers have stepped up to serve them. Now that we're bringing back the seniors on April 12th, it's going to really pave the way for other populations, as Dr. Williams mentioned. We have had great success in having events like the SAT, other activities to make sure kids are connected, and our athletics, of course, which is now going to be expanded to sideline cheer, to band, and to other things that the guidelines have changed and is now permissible. So little by little, the kids are coming back and we're keeping them connected. So stay tuned. And so far, we've been very successful of doing it safely, which is number one.
Okay, so I have a question here. How come some high schools get to have a prom and others don't? This person says that there is a school in our district having a prom in Newport Beach on a boat. I don't know if that's true, but they say that, and they're at their kids' school, they're not having an in-person prom. So,
okay.
I don't know
Would you like me to take that, Dr. Williams?
Sure.
Okay. So right now we're in the planning stages, and it's really important. We've learned not only in education, but I would imagine in all industries, you got to have a plan A, a plan B, and a plan C, right? So our principals are doing a fabulous job of saying, this is what we would absolutely like. And what you're describing, Newport Beach on a boat, that sounds wonderful. I'd love to be a part of that myself. But we have to follow what public health guidelines allow. And currently, the guidelines for education have not changed in terms of the 3 household gatherings. I know that sounds like it's in conflict with the returning of students to schools, but every group has various guidelines. Churches have guidelines, gyms have a set of guidelines, and so on. So was just on the phone today with public health, and they said that the guidelines are going to be, an update to the guidelines will be coming out very soon, and events are being allowed. For example, football games are now permissible. Baseball games are permissible. And they are allowed to have an outdoor group of spectators, depending on the square footage and capacity of the venue, to allow for safe social distancing. So right now we're in the planning stages for the proms. As we get more information, we will have an update as to what is permissible and what is not permissible. Anything to add, Dr. Cavalli, to that?
Thanks, Dr. Rubalcaba. Yeah, I think you said it perfectly. I mean, we want your children to be safe, but we want to follow the guidelines from public health. That includes California Department of Public Health as well as San Bernardino. We're almost there. We've seen community spread of COVID drop dramatically, and it's coming. Over the next few months, we will have more and more children back to school. We will be back to some sort of normalcy. It's happening. We just have to be sure, like Dr. Rubalcaba said, that we're following all the guidelines and we're doing it systematically. We don't want to just rush in and have there be, a big outbreak. So we're doing all we can, and I think the district really has been working together to ensure that everyone stays safe.
And and I would just like to add, as we started off with the plan last July, that changed in December, changed multiple times in November, December, January, February, and sometimes it's changed multiple times over the course of 1 week. Although we started with one plan based upon the guidelines that was given to us from public health at that particular point in time, there has been revisions to the color spectrum, to the band for each one of them. And so we've had to adjust to each one of those. And I know that some of you says, okay, well, you started this last year. Shouldn't you have a plan for every? The guidelines have changed, not only on the public side, but on the federal side as well. And the county as well. We've got that consistency there, but that's been, this plan has probably been revived at least probably a half dozen to maybe 10 times in between the past summer and now. And if there's some changes in the guidelines again, we'll have to adapt to those, because anytime there's changes there, because our board was very fortunate to approve our educational continuum, in which we had 25%, 50%, 75%, and 100% basically, that we thought that we was going to be bringing students back. There was no discussion. There was nothing in the guidelines that said anything about seniors, that secondary schools, first of all, you had to bring back at least one grade level, and then you could review how well your plan was being implemented at that particular time, and then you could move on from there. When we started this process, that was not one of the variables that we took in consideration until we received those guidelines from the Public Health Department. So we are adapting. We appreciate those of you that's just demonstrating patience, but we feel at this particular time, assuming that there's no changes within the next couple of weeks, our intent at this time is that April the 12th, that we will have our seniors, and then we will explore the other options as time moves forward. Go on, Mr. Raleigh.
Okay, and I think we kind of already talked about this, but I just did want to go through and show some of these things. The standard to get all students back full time. In other words, I think what they're saying is like, when and what is the kind of standard where we're going to have everybody and we're going to go back to normal just like it's February 2020. I mean, and that seems so far away, but what would it have to look like in terms of our COVID numbers for that to happen? And I don't know if one of you or maybe Dr. Cavalli can talk about that.
I can start us off. It really is based on the data, on positivity rates, cases per 100,000, what's happening, the trends in our own district. I'm really happy to say, I cannot remember the last time we had a positive case from one of our employees. It's been that long. It's been weeks and weeks. And that's because of a lot of the safety measures that we've put in place, greater awareness, more people are being vaccinated, and so forth. So as we move through the color tiers that the governor established, there will be restrictions that are loosened that allow us to safely return back. And I think initially it's going to be with precautions like face covering and so on. And until we establish probably that herd immunity at I'm guessing Dr. Cavalli can say maybe 80% or greater, then we're probably going to be able to really loosen up the restrictions and get rid of the mask. But I'll defer to Dr. Cavalli.
Yes, I absolutely agree. I think that herd immunity is very important. You know, we'll get there somewhere when we get to around 70%, 80%, like you mentioned. Then we'll feel comfortable with that to disregard the masks, disregard the social distancing. But for now, that's really what we have to hang our hat on. Is we have to continue to social distance. We have to continue to bring students back in a systematic fashion, and adhering to guidelines. That's really the big takeaway here.
And can I say that it may be an ebb and flow? If we bring more students back and we see that, hey, cases are starting to rise, we have the discretion to say, okay, let's scale it back. And we're going to do so in a very strategic manner, monitoring the data and meeting the needs of students. Our seniors, this is their last opportunity to have somewhat of a senior year and have closure to their K-12 journey. So that was a real top priority for us. But some of our 7th graders and 9th graders have never seen their schools, never stepped foot on their campuses, and we want to support them. Some of our students with special needs really require that in-person support, and we want to make sure that we're responsive to any population and meeting every student's need.
And I would probably just add also, because I was just looking at the chat here, and there was a question in regards to April 12th will elementary students return this year with their only being like about 45 days left. Keeping in mind, we're 712. There's about approximately 4 elementary school districts that feed into us. My understanding at this particular time is that a number of the elementary school districts primary grades are back in session in some form or fashion, maybe in a hybrid model, but it's very difficult for us to speak in regards to the elementary schools.
Right. There's one here, and I'm just going to address this myself. I know we're returning the kids to school because obviously we want to have kids back in school, but I would question what is the purpose of putting a whole bunch of people inside a relatively enclosed space, practically shoulder to shoulder, to have a board meeting. I know ideally we would give people the option to come and be there in person, but even though we are on a better trajectory, I don't believe we can say it's safe to have any number of people at a board meeting that would even make it worthwhile. I mean, first of all, you have all of those members in there, board and cabinet. Usually they're lined up together. We don't even have the room to do that. I mean, we don't have the room to put those people in there socially distanced, let alone have someone show up and attend the meeting. I mean, maybe we'd have an audience of 1, but I can let any of you address that as well if you'd like. Let me take that one on. But I was looking at the chat. And so while I'm looking at it, let me address that also. No, we're not saying that our middle schools are going to set empty. We said that we were starting with our seniors. There's special needs that our 7th graders need. There's unique needs that our 8th graders have, 9th graders, 10th and 11th graders have. And as we are assessing those needs, we will make an informed decision. Our board members, we're working on potentially this next board meeting to socially distance them and have them in the same room if at all possible. But we are looking at it, and the board is looking at that as well. Someone else. We will bring it back to an in-person board meeting as soon as it is safe to do so.
Can I just add that one of the side effects of the pandemic is that it has forced us to become more innovative. And by hosting virtual meetings, we've increased the access of other people to engage in the process of the educational journey, of the decisions that are made. So more people are able to view the board meeting now that we're on an online platform. And that's important for equity and access in of itself, making sure that people who may not be able to get to the boardroom or board meeting in person can now access and be informed on what's happening in our district.
Okay, and this is kind of a repeat of a previous comment here. They're asking about a timeline for when we can have all the students back, but we don't set the timeline. I think COVID-19 sets the timeline. So I don't know who would like to talk a little bit more about that.
Well, I'll pass it on to Dr. Covella. And we may not know the answer to that at this particular time, but I'm sure he'll do the best that he can.
Thanks, Dr. Williams. Yeah, I think that's exactly right. We just don't know. Based on what we've seen in the community, COVID-19 rates have dropped astronomically. That's wonderful, right? But we just don't know the ongoing trajectory of this. It can pop back up at any time. I saw a few of you mention comments about variants popping up. It is a concern, and we just have to keep doing our best to try to limit transmission. You know, the passing on of the virus from one person to another. So, short answer is I don't think we know yet, but hopefully soon.
I want to, just looking at these comments, reiterate a couple of things. Number one, yes, only seniors right now. That doesn't mean forever, it just means right now. Number two, April 12th is the day. And I'd also like to address some misinformation in one of these comments here, saying that other districts are bringing all of their kids back. And I'm sorry, that is not true. You have other districts that are unified school districts who maybe have brought some elementary school students back. We don't have elementary school students. And you guys may know more than me, but I am not aware of districts, large districts, that have all of their students back. I don't know if anyone wants to talk about that.
Well, there are, there's 58 counties in the state of California, and depending upon their positivity rates, we have some districts throughout the state that they've had their students back for an extended period of time. But their positivity rate, as well as their per 100,000, is probably in a different range than what we've had it in San Bernardino. San Bernardino County was deeply, you go ahead.
Sure. I'll pick up, Chris, if you'd like. One of the things to keep in mind is we have been very cautious and conservative in our approach, which has proven to be successful. We have started small, with small cohorts, with small events like SAT, and we chose explicitly 12th grade to start off small and make sure that we have everything in place to keep everyone safe. We do intend to bring back other groups appropriately. And, as Dr. Cavalli mentioned, we don't know exactly when we can bring back everyone, but that wouldn't necessarily be the safest approach. And we want to make sure that we're taking our time to do it right. We only get one time to make that first impression in keeping everyone safe, building the trust and credibility in our leadership.
Okay, someone asked, I believe this individual is a student because I've heard from them before. We got an email here. They asked about small cohort and how we have certain special populations of students who have already returned who are not seniors. And they simply wanted to know why that is.
Well,
I can take that response. Oh, sorry.
Okay, before you address that one, I've seen a couple of comments in regards to mental health services for our students and as well as our staff. We want the community to know that we're in the process at this particular point in time of hiring 5 or 6 mental health clinicians to work with our students because we've identified that need as well. And we want them to be available to support our students, and as quickly as we can get them hired and providing services to our students, we will do that at its earliest time. Dr. Aswani?
Dr. Aswani, I think you're muted. I unmuted you. There you go.
Thank you. Thank you. I was going to just respond to the small cohorts and say that, again, we're following the guidelines. It is really important we reach out to the students who need a lot of one-to-one support. And as we start experiencing success with the students and they experience success in the small cohorts, the plan is to start bringing back different students in cohorts. As we've mentioned previously, We started looking at foster youth, homeless, our students who don't have a connection at home, and bringing them into a learning pod. Then we started thinking about our seniors who are at risk of not graduating. We also started on Saturdays at most of the schools. Our freshman students really struggled with the first year of high school. And similarly in middle schools, they're looking at 7th and 8th grade students who are struggling. So again, as we're mentioning, as we're getting a little bit more comfortable with the safety issues and making sure everything is being followed correctly, and there's a lot of confidence in the processes we put in place, we will start bringing back additional small cohorts, especially our juniors that have been identified as the group we need to look at next, because we have the rising seniors who are our current juniors also struggling and need some support. So just stay tuned. We'll be coming to you with more additional small information very soon.
Thank you.
Dr. Williams.
I had a couple people asking about graduations. Christian Gomez, Eddie, and Jessica here. Anybody want to take that one?
I'll be more than happy to. At this particular point in time, graduations, depending if you're a good month and a half away at this particular time, it's going to be dictated by the guidelines that we have to work through public health. But we are planning for both, and we will adapt based upon that time frame, that the guidelines that we have at this time. We would love to have them in person, but the guidelines will dictate what we can do at that particular time.
Okay, thank you very much. So we got a question here from Elanya Grissom. Can failing students come back, or at least the failing students that need to want to come back to get their grades up, or do they need to wait? So I believe they're asking, if you're failing, can you come back in person? I'm not positive, but I think that's what they're asking.
Dr. Williams, can I take that question?
Sure, go ahead.
Go ahead, please.
Okay, so we have been continuing to provide after-school remediation. And I know students who are online right now, we are following the comments, many of you are students. This online education and distance learning is really getting to you all, and we can read that frustration and the impact it's having on you. And therefore, it's very easy to just look away and then your grade starts slipping. And it isn't our intent to keep adding more online stuff, as an option. But at this point in time, until we get absolute clearance that everybody can come back, we have continued to provide our teachers, especially a group of our teachers, stayed with our students all through last year, all through summer, and all through this year, allowing students to make up the F grade. And I just want to mention that I hope the message has reached you all, because we've tried to get it out in many ways, that when you remediate an F grade, you don't have to do the whole course again. So the after-school remediation is only 70%, which pretty much is you read the units and you take the quizzes and you keep moving through the course. They are A through G approved courses, so they're not impacting if you are making up a class. The highest you can get is a C. But an average dedicated student can finish a course within 15 hours. And so I would ask you that if you really are somebody and you know somebody who's failing a lot of classes, please reach out to Mr. Riley at that email address. He'll forward your address to me, and we'll have somebody contact you. And other than that, always your principal and your counselors are within your reach. Email them and ask them. But you can make up those classes. Now, your question also was, can students come to campus to make up those classes? Well, we haven't started offering the remediation courses on campus right now. The 9th grade students or the students who are struggling in 12th grade that were coming back, they're getting a chance to work with teachers and get some support to make up the grades in the classes they're currently enrolled in. So maybe we will start offering the remediation classes live, but to take advantage of it right now, please reach out to your counselor or your principal or email Mr. Riley, and he'll send me your details, and I'll have somebody contact you to sign you up for credit or remediating the F grades on your transcript right away. And it really is the whole course all over again, like a semester. It's been designed, it keeps kids, a student attention in mind. And so you can proceed through the test very quickly. We have students finishing right now, a couple of students have finished a full remediation course in 10 hours, 10 hours of dedicated time. So thank you for that question. I think that was a great question.
Question about schedules. I assume that there's going to be some contact that's going to come from the school sites, but I don't know which one of you would like to address that one.
I'll be happy to, Dr. Williams, if you want me to.
Sure.
So yes, that is correct, Chris. Our principals have done a fine job working on the schedules for students. The current plan is Monday, Tuesday, one group will come in, same schedule as previously. Wednesday will be a remote learning. Thursday, Friday will be the second group. So right now, the current plan is that they're split in half, and they will receive some type of notification from their school site.
Okay. All right. So we did get an email before the meeting even started, which I shared with a few of you. And I don't know if you guys were able to take a look at some of those questions. This individual had a number of questions, and we don't want to spend all night on just one person's questions, but we do want to try to address some of these things, obviously, as much as we can in the time that we have. So, who is cleaning the desks between each student after every period? And who wants to take that one?
I'll be happy to, Dr. Williams. We've got to keep in mind that our students at the secondary level are very different than the elementary experience, where it's not a stable cohort, right? You don't have one class, one teacher of 30 kids. It's 6 classes of 30 students, or 7 classes. And our secondary students at the high school level and middle school level switch period by period, right? Period 1, period 2, period 3, and period 4, and so on. So the short answer is that our students, very much like when you go to the grocery store and you pick up a wipe and you wipe down your shopping cart, when our students enter, they'll have their workspace, their desk with the desk shield. They'll be able to get, as they enter, a wipe, a sanitizing wipe down their workspace, use their workspace, and before they leave, they'll wipe it down a second time to leave it clean for the next group. But the second group that comes in, say period 2, will follow that exact same process. A student picks up a wipe, sanitizes the area, uses it, sanitizes it again. We don't have, our teachers, don't clean desks. Our classified staff, we don't have sufficient staff to have someone assigned to each room to clean in between each use. So that's the best that we can come up with in order to make sure that each area is as clean as possible. Especially dealing with high school students, we believe that's something that is absolutely reasonable and has been a pretty common practice across the state from what we have seen other school districts do.
Okay.
Dr. Hawkins, would you like to add anything to that?
Yes, Dr. Williams, there's a lot that I could add, but because of time, I'll just truncate it. I want our community to know, in concert with what Dr. Rubalcaba just articulated, we're ensuring to properly staff so that we have effective cleaning, not just throughout the day, because that's one component, but there also will be scheduled cleaning that occurs in the restrooms, high touch areas such as doorknobs and handrails and so forth. And the district has also pivoted to, because one of the questions has been consistently air circulation and ventilation. We have pivoted to ensuring that we're using the most up-to-date air filters. We're at MERV 12 now. We're also bought some bipolar ionization units to be able to negate any virus transmission. And I want you to know and to be assured that we have touched bases with staff and talked with staff and the leaders in maintenance and operations to make sure that we have a robust cleaning schedule that is effectively utilized on a regular basis to ensure the safety of not only our students, but our staff as well.
Thank you. We're so pleased that Tanya Martin, the president of CSEA, has joined us. Tanya, would you like to share a few words with us?
I'll just say good evening. I have been watching the entire broadcast. I've been kind of in the waiting room for some time, but I'm excited to see children come back. The district has put a good plan in place. So kids, get ready. You're coming back one at a time, but we will see you all soon. That's it.
Okay, thank you. Mr. Riley, others?
Yeah, well, you know, there's something in here about the board meeting, which, you know, I myself talked about. And, you know, I'm gonna let you guys address this a little bit more. But what I said was that, you know, we have students returning to school to be educated. And I understand there's also a great civic purpose to a board meeting. However, I would say that there is a greater importance to having our children in school as much as possible. Now, of course, it is limited and it is by choice. So I think there's, you know, I think it's kind of apples to oranges if we're talking about comparing this to a board meeting. At any rate, we would like to have live in-person board meetings as soon as we can, as soon as it's safe to do so. And I don't know if anyone else wants to speak a little bit more about that.
No, I think you did a very good job. I'm just looking at the time here, and I would like to give each one of our panelists at least 30 seconds to add any closing comments. I know that for those of you that's accustomed to Zoom, this was our debut of our new production, and we want to set it. We're going to be setting up sometimes on either a weekly basis or bi-weekly basis for about a 30-minute time frame to give our community updates. And so we're going to be inviting all of you back to our studio, like I said, on a weekly basis or bi-weekly basis. Next week, we're not going to be, the show is not going to go on because the district is going to be in a spring vacation. But after that, we will be having at least a 30-minute show either every week or every other week. And so you can go to our website and stay tuned for that. So with that, let's go to closing remarks. Dr. Aswani, would you like to share a few closing remarks that you may not have been able to address before?
Well, all I want to say is that, you know, I just look at our students and honestly, in many ways as we can, we want you to know that we love you and we feel for you, and we know that this is the most uncomfortable situation that anybody's been in, and it's just not fair that you are having to go through this. You know, it's once in a while that we are facing this kind of a situation, and then you guys are in the thick of it. So we feel for you and we know what's going on. None of us are prepared for this. We're doing the best we can. We're trying to bring you the resources the best we can. One size does not fit all. I'm looking at the comments again. Some comments about some tutoring didn't work for some kids. Some students didn't have some good experiences with their teachers. All I'm going to say is that it looks like we're coming out of this slowly but surely. Just hang in there a little bit with us. And we wish you a safe and a very happy spring break. Rest up a little bit, and we'll see you soon.
Okay, thank you so very much. Dr. Hawkins?
Thank you, Dr. Williams. I'm going to be very brief. I'm just going to address one thing that's been a theme I've seen in the chat, and I want the parents to know that we are concerned about safety. And there was a question that came up regarding nurses and so forth. We're fortunate to have our CSCA president, Ms. Tanya Martin, who's on this call. She is a LVN, and she has put together a good safety plan for all schools as a part of her scope of responsibilities and duties when it comes to medical emergencies. So just know that we're looking out for your children, which are our children when they're with us, to make sure that in all areas, not just PPE, not just cleaning solutions, not just all those other things I mentioned earlier, but to the point, to the questions regarding student safety, if a student may be a diabetic or something like that, we're also looking out for that as well. And I just want all of you to stay safe and to know to keep the questions coming. We're here to answer them so that we can together as a community have a good end result. That's all I have to share.
Thank you so very much. Dr. Rubakawa?
Thank you, Dr. Williams. Just want to let you know, as everyone has said, We care deeply about our students, families, and staff, and we're doing everything we can to keep them safe, to keep them engaged in the educational process, to meet their physical and social emotional needs. And we appreciate the partnership with all of you. Thank you and stay safe.
Okay. And Dr. Cabela.
Yes, thank you. I also just want to reiterate that I really think your district is doing everything they can to ensure the safety of your children, your family. Patients at St. Mary Medical Center, we feel like they're our family, and I personally feel responsible for them and ensuring their safety. And we're going to ensure that your kids, your family, are also at that same safety when coming back to the classroom. So really, your district is doing everything right, perfectly in my mind. So you really have nothing to worry about.
Thank you so very much. VVT President, Mrs. Tucker.
I just want to say, on behalf of your certificated staff, the counselors, the teachers, the coaches, our district librarian, we have been here for the past year for your students, for you. We're going to continue to be here, whether we're teaching remotely, hybrid, in person. We're here for the kids. That's our job. We do it with a smile, and we're there. And we wish you a great spring break, and we look forward to seeing you when we come back. Thank you.
Okay. And Mrs. Martin, President of CSEA. Oops, I think you're on mute.
I'm gonna unmute you. Okay, Tanya, you're unmuted now. Go ahead.
I would just like to say on behalf of the classified staff, we have been here since day one. We have all basically been working since the pandemic has started, and we've got the areas clean for you. I've walked all the campuses, and they are as safe as possible. Your children will be social distance, and they will be safe. Just hold on one at a time. We'll come back in a safe, effective manner, and we'll see you all soon.
Okay. And it's at about 5:58, and I just thought I'd say a few words. We'll be very respectful of our panelists' time as well as our community as well. Our meeting was scheduled from 5 to 6, and it's about 5:58. We want to thank all of you for tuning into the Victor Valley Union High School channel at this particular point in time. And I know that some of you had a few questions about graduation. We will not wait to the last moment, even though we know that this pandemic does not have a time cycle built into it. But we will keep, if we're having these telecasts on a weekly or bi-weekly basis, we will keep you informed each and every week of where we are in regards to this. It would be our pleasure to see our students in face-to-face, but we know that we would have to deal with the social distancing. But we want you to know that we will do everything possible to make sure that the graduates of 2021 and the graduates of 2020, that was a challenge. I know we had the virtual, and they did a phenomenal job there. We will do everything that we possibly can to have it in person, but we will have the ceremonies one way or the other. And maybe at our next meeting, we'll be able to give you a better update to that. So on behalf of the Victor Valley Union High School District, our Board of Trustees, our association, the cabinet, Mr. Riley, as well as Dr. Cabela, we thank you for attending, and we hope that you tune in to us shortly after we return from the spring break, and we hope that everyone will be safe. Have a nice evening. Bye-bye.
Thanks, everybody. And thanks, Dr. Cavelli. We'll get you the bill as soon as possible. Just kidding. All right. Have a good one, everybody. Good night.
Okay.